Before you start taking Farxiga 5 mg tablet, make sure to read the medication guide and patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily, with or without food. The dosage is based on your medical condition and response to treatment. To get the most benefit from Farxiga, use it regularly and try to take it at the same time each day. If your condition does not improve or worsens, make sure to inform your doctor. You may experience frequent urination, dizziness, or lightheadedness. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. This medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Remember that many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including signs of a urinary tract infection, signs of kidney problems, or very serious side effects such as unusual tiredness, nausea/vomiting, stomach/abdominal pain, or trouble breathing. Dapagliflozin can sometimes cause painful urination or pink/bloody urine that are usually signs of a urinary tract infection, but may also be signs of a rare condition, bladder cancer. Tell your doctor right away if you develop these symptoms. This medication may also cause a new yeast infection in the vagina or penis, as well as a rare but very serious bacterial infection in the genital/anal area in people with type 2 diabetes. This medication may cause you to become dehydrated, leading to serious kidney damage. If you are taking dapagliflozin for diabetes, it does not usually cause low blood sugar, hypoglycemia, but symptoms of high blood sugar, hyperglycemia, include increased thirst/urination. If you notice any symptoms of a serious allergic reaction, get medical help right away. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Before taking Farxiga 5 mg tablet, make sure to inform your doctor or pharmacist if you have any allergies. This medication may contain inactive ingredients that can cause allergic reactions. It's important to discuss your medical history, especially if you have kidney disease, pancreatitis, dehydration, a history of yeast infections, or if you use or abuse alcohol. If you have diabetes, you may experience blurred vision, dizziness, or drowsiness due to low or high blood sugar. It's important to avoid activities that require alertness until you are sure you can do them safely. Limit alcohol while taking this medication, as it can increase the risk of low blood sugar and high ketone levels. Stress, illness, or surgery may make it harder to control your blood sugar while taking this medication. It's important to consult your doctor if you experience any of these conditions, as it may require a change in your treatment plan. Before undergoing surgery, inform your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially dizziness, dehydration, and kidney disease. If you are pregnant, discuss the risks and benefits of using this medication with your doctor. Pregnancy may cause or worsen diabetes, and your doctor may need to adjust your treatment plan. It is unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. Drug interactions can affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Beta-blocker medications may prevent the fast or pounding heartbeat you would usually feel when your blood sugar falls too low. Other symptoms of low blood sugar, such as dizziness, hunger, or sweating, are unaffected by these drugs. It's important to talk with your doctor or pharmacist before starting, stopping, or changing any medication, as many drugs can affect blood sugar control in people with diabetes. Make sure to check your blood sugar regularly and share the results with your doctor. If you experience symptoms of high or low blood sugar, be sure to tell your doctor right away. They may need to adjust your diabetes medication, exercise program, or diet. It's also important to be aware that this medication may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are taking this drug. If someone has taken too much Farxiga and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the US, you can call the local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Never share Farxiga 5 mg tablet Antihyperglycemic-Sod / Gluc Cotransport-2, Sglt2, inhibitors with others. Before starting and while taking this medication, you may need to undergo various lab and medical tests, such as kidney function, liver function, blood sugar, hemoglobin A1C, complete blood counts, cholesterol tests, and ketones. It's important to keep all medical and lab appointments. Consult your doctor for more details. If you have diabetes, it's recommended to attend a diabetes education program to learn how to manage your diabetes with medications, diet, exercise, and regular medical exams. It's also important to learn the symptoms of high and low blood sugar, as well as how to treat low blood sugar. Be sure to check your blood sugar regularly as directed. If you forget to take a dose of Farxiga 5 mg tablet, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next one at the usual time. Do not take a double dose to make up for the missed one. It's important to store Farxiga 5 mg tablet Antihyperglycemic-Sod / Gluc Cotransport-2, Sglt2, inhibitors at room temperature, away from light and moisture. It's also important to keep it out of reach of children and pets. When it's expired or no longer needed, be sure to properly discard it by consulting your pharmacist or local waste disposal company. And remember, don't flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.